presenting on behalf of the group from Nigeria. I'll be presenting the effect of motivational interview on intake among patients with hypertension in Nigeria and Uganda. Now, we realize that increased salt intake is associated with hypertension and cardiovascular diseases, accounting for over 10% of deaths from cardiovascular causes. We also notice that salt consumption is very high among Nigerians and Ugandans. They put a lot of salt in their food, salt in the seasoning they use in cooking, and then in addition, they add salt to food even after serving. And these are not healthy practices. In spite of that, we noted that national policies on salt reduction strategies are either absent or where present, they are at best at the contemplation stages in both countries. We also note that healthy diet contribute to reduction in hypertension through early intervention, and such healthy diet will include reduction in salt intake to less than 5 grams of salt per day. It therefore means that measures that are aimed at reducing salt intake would provide a low-cost method of blood pressure control, taking into cognizance the socioeconomic status of people in sub-Saharan Africa, particularly in the two countries. So this study, therefore, is based on the hypothesis that motivational interview, which we intend to administer to our study participant, would produce a positive behavioral change in the populace. And this positive behavioral change will translate into a significant reduction in salt intake. So what would be the impact of the study? If we are able to get a reduced salt intake from our study participants, then the study can be extended to the entire nation. Policymakers could use findings from the study, and then measures targeting reduced salt intake would therefore produce low-cost measures of reducing blood pressure control. And this will lead to improvement in the cardiovascular health among patients with hypertension in both Nigeria and Uganda. Findings from this study would also assist policymakers and health workers to incorporate salt reduction measures to achieve blood pressure control. So in our various clinics, measures aimed at reducing salt intake will be incorporated in hypertension care. And of course, these two measures will lead to anticipated reduction of uncontrolled hypertension in Nigeria and Uganda, which is currently very high. Over half of hypertensives in the region have their blood pressure not controlled. So the aim of our study is to explore the use of motivational interview to achieve a reduction in salt intake among patients with hypertension in Nigeria and Uganda, to achieve better blood pressure control among patients with hypertension in the two countries. The theoretical framework of our study is based on motivational interviews. What is motivational interview? Motivational interview is a person-centered counseling approach that is aimed at effective behavioral change through empathy, supporting self-efficacy, and reflective listening. So it is different from the normal counseling that is done in the clinic. The practitioner elicits and reinforces through reflective listening positive self-statements directed at positive behavioral change. So it is patient-driven. The patient is allowed to set his own goals and then set measures on how he intends to achieve the goals. What the physician does is to guide the patient and help the patient make informed decisions. It is based on 3 fundamental components of collaboration, evocation, and autonomy. So the patient is at liberty to set his own target, make his own decisions, and decide how he intends to follow through. The physician guides and provides the knowledge for the patient to take such decisions. And these principles have proved very useful in addressing many behavioral health issues, such as substance abuse disorders, smoking addiction, and chronic medical conditions, including diabetes, asthma, tuberculosis, and HIV/AIDS. So it is our hope that motivational interview can also be directed towards helping patients reduce their salt intake and, in essence, reduce their level of blood pressure control. What are the methods? How do we intend to do it? We intend to conduct a randomized control trial of 156 adults. We're going to take 78 in Nigeria and another 78 in Uganda, age 18 years and above, who are presenting with hypertension to the general outpatient clinics of the University College Hospital, Ibadan, Nigeria. We'll systematically recruit these patients and then we'll follow them up for 6 months. We chose these 2 centers because there are centers where we have a good number of patients cut across the various geopolitical zones of the country. So we felt the 2 centers are very representative. Now, patients will be randomized into the intervention and the control group. The randomization will be done at the clinic level. So systematically, as patients come, we select them, categorizing some into the intervention group and others into the control group until we meet our sample size. The intervention group will have monthly sessions of motivational interview on salt intake using a trained MI expert for the 6-month duration of the study, in addition to the standard care for hypertension. So at baseline, when we recruit the patient for the study, we'll give both of them, both the intervention and the control group, we'll give them the standard hypertension care. We take their blood pressure, we counsel them, we give them medications. After that, the control group will leave them and continue to give them standard care throughout the 6 months. While for the intervention group, every month, we will invite them and then they will have a session with our MI experts. So they are going to have 6 sessions in all. And at the end of the period, we would assess them. So data will be collected at baseline when we first recruit them, and then at 6 months when the study will end. And then the data will be analyzed for probable significant difference in salt consumption and blood pressure control in the 2 groups. And our study outcome will be salt intake reduction and blood pressure reduction in the intervention group compared with the control group. So we want to find out those who had these monthly sessions of MI compared to those who didn't have. Was there significant difference in the salt intake? Was there significant difference blood pressure reduction? This will be done at the end of the study, which is 6 months. What stage are we in our study? We have prepared the proposal and have submitted, which luckily for us have been approved. We have also gotten ethical approval from the University of Ibadan to conduct the study, and the assigned number is UIEC 210370, while the ethical approval for the Ugandan arm of the study is underway and hopefully will be out very soon. It has reached an advanced stage. We have also recruited our research assistants and they are on standby. Both study sites are ready. We've notified like in University of Ibadan, where we have gotten the ethical approval, we have informed the head of the General Outpatient Department of University College Hospital. With our approval, they are aware we are about to conduct the study. We've also notified the staffs in the outpatient clinic, and we've asked for their support, which they've promised, and our research assistants are ready. All we are waiting for is to get the funds so that we can start the study. So this is where we are. Thank you very much.